Good evening and welcome to City News. It's a development that Ontario's health minister is calling concerning. The number of daily new COVID-19 cases across the province now spiking at a level that hasn't been seen since the end of last month. Official numbers released by the province today show 203 new infections. That's the first time since June 29th that the daily total has risen above the 200 mark and pushes Ontario close to the 38,000 mark in total cases. One additional death is also being reported. Now, the breakdown from the province shows 57 of the new cases are from Peel, although Mississauga Mayor Bonnie Crombie today disputing that number, saying it's actually 22, claiming the difference is due to the region moving to a new data reporting system. Elsewhere, Ottawa is reporting 43 new cases, more than double than the day before. 30 are from Toronto, 24 are from the farming region of Windsor-Essex, and another 10 were reported in York region. 57% of the infections reported today are among people who are less than 40 years old, and Premier Ford had a message for young people today.
Don't go to a party, simple, because it might not be you, but it's going to be your parents or your grandparents, as I always say, or your neighbors or your friends or relatives. You're hurting people by doing this.
Now, a big percentage of the COVID-19 cases in the province to date have, of course, come from long-term care facilities. And as a result of that, there has been a shift in focus from the province. They want more new beds added, although any announcements that have made to this point haven't exactly been new. A plan to accelerate the building of 2 new long-term care homes in Mississauga was actually introduced today. Premier Ford was at one of the sites where an announcement for a new facility was made last year and said the province intends to add up to 640 new beds by 2021. It's going to be part of a pilot program to speed up projects and have facilities constructed by partnering with hospitals and using different methods.
A typical project, even a regular development project, building an apartment or condos or whatever, can take 3, 4, even up to 6 years. But this is proof when we work together, we're going to get this up. From the time you see us put the shovel in the ground, we're going to push for 7 months, unheard of anywhere in North America.
Through a range of enabling measures, such as modular design and construction, rapid procurement, shorter construction timelines, and use of hospital lands, we are targeting completion in 2021.
Now, the government says there are more than 38,000 people that are on waiting lists to get into long-term care facilities. On another note, there was a promise back in May to make sure an independent commission into the long-term care system was actually going to be moving forward. At this point, still no mention on when that is taking place.